The main mission of the Afiya Center is to positively impact and transform the relationship of Black women with our bodies and sexual reproductive health to foster complete mental, physical, and spiritual wholeness, one that is grounded in absolute autonomy and free of reproductive oppression. When we founded this organization, HIV was rampant. It seemed like nobody was talking about Black women. When I looked at the data, it was like in Texas, Black women were disproportionately impacted with HIV, but there were no programs. Like there were no real programs. That was problematic for me. It was problematic for the co-founder. We founded this organization using a social justice and a human rights lens because we know that if we could change the systems that women were living in, the behavior would automatically change.
One of the things that's fascinating in the state of Texas as it relates to the law and reproductive rights is there seems to be a fixation on taking away the agency that women have regarding their reproductive access. In the last probably 9-10 years, there's been an onslaught of legislation put forward to inhibit women's access to abortions. The Afiya Center is working to advance policy in a number of ways. We have chosen 3 pillars that we are going to approach policy. Abortion access, maternal mortality is one of the pillars, and HIV is the 3rd pillar. So as the policy director, I have the opportunity to provide education to policymakers on how the legislation that they are considering will impact the everyday lives of Black people.
The work of the Afiya Center is so vital. They're on the front line. They're making sure that Black women's voices are being heard. They're trying to break the stigma of reproductive health and abortion as it relates to Black women, and that's important because Black women are the backbone of our communities. The State of Black Women Health Report is a comprehensive report on the maternal mortality of Black women in Texas. The report is important because it gives out all of the data and the statistics of what's going on with Black women as it relates to maternal health. It also has recommendations. I think that's one of the most important things is that it has recommendations on how we can fix the problem here in Texas.
We talked about the state of Black women in Texas as it related to education and economics, so we put education and economics together. And that was our very first report, and people listened.
It's important that Black women have people on the front line working for reproductive justice.
Reproductive justice, it allows folk to have full bodily autonomy. Texas Black Women's Reproductive Justice Summit was a summit that we decided that we needed to have. We thought it was very important that Black women and other women of color be leading this movement because this movement was founded by those women. The mothers of reproductive justice were Black women, and that is why we did Texas Black Women Rise Up, because we intended for Black women to rise up, to be seen, and to be heard, because prior to, we were not being seen and we were not being heard.
In my work with helping the Afiya Center assess community needs, I think it's very important that we understand the needs of a community indicate their voice for their requirements, their essential basic wants and desires. Basically gathering actual tangible data to be able to set the tone and the standard for addressing reproductive justice. The other ways that I've helped with the Afiya Center is to assist in evaluating their advocacy work, in helping to conduct evaluations, making sure that they effectively increase knowledge and awareness about major issues or concerns when it comes to reproductive justice in women's bodies.
I see no limits for the official of the Afiya Center. We do amazing work around birth work. We have doulas. Hopefully in the next 6 months, we will be opening up a birth center. And the goal is for that birth center to not just be a birth center, but a place where women can come and get the full spectrum of their reproductive health care. And then the next thing I'm super excited about is the Black Women's Think Tank. That is going to be the game changer for this organization. When you have a space that's going to be housing all of this amazing Black brilliance, our vision statement is just very simple, that we are working to end reproductive oppression for all women, period.